Kisumu has been at the heart of malaria research in the country for nearly 3 decades. The Center for Global Health Research at the Kenya Medical Research Institute in Kisian has pioneered malaria research in the country that has seen Kenya adopt prevention measures and treatment regimens for a disease that affects 255 million people across the world and killed more than 100,000 people in 2021. Most of these deaths occurred in sub-Saharan Africa, where malaria researchers say efforts to curb the deadly parasitic disease are met with ever-changing complexities.
We have worked very closely with the Division of National Malaria Control and the Ministry of Health from the time we were conducting the phase 3 trial, because we were one of the 11 sites in 7 countries that were doing the phase 3 trial of the vaccine. And those results are what informed the piloting of the vaccine.
Dr. Simon Kariuki has spent the last 29 years conducting epidemiology research on malaria, the same amount of time it has taken to develop the RTSS vaccine. He says Kenya's nomination to take part in the phase 3 trials of the malaria vaccine was the fruit of intense investment by the government and development partners to raise local research to global standards.
With the basic infrastructure that we've put up in place, now we are able to participate in any clinical trial.
The Center for Global Health Research is run in collaboration with the US Center for Disease Control and the UK Liverpool School of Tropical Medicine, and was responsible for managing the phase 3 trials of the malaria vaccine in 8 counties across Nyanza and Western Kenya. The trials were hosted in 25 sub-counties, targeting more than 100,000 children under the age of 5 in the counties of Vihiga, Kakamega, Bungoma, Busia, Homa Bay, Migori, Siaya, and Kisumu. According to the World Health Organization, more than 1 million children in Kenya, Ghana, and Malawi have received at least 1 dose of the malaria vaccine, and WHO estimates that the RTSS vaccine could save between 40,000 and 80,000 young lives annually. It is a busy morning at the Yala Sub-County Hospital's Mother and Child Clinic. Mothers have brought in their children for their routine checkup. Some of the children here will be receiving different doses of the malaria vaccine. And for health workers here, the health talks before vaccination begins in the last 2 years of the trials have gone a long way in winning the hearts of parents to have their children receive the malaria vaccine amidst misinformation over the safety of the vaccine.
We used to get resistant mosquito from partners, that is a male partner, that is the fathers to the children who we used to immunize by then. Then until the mother can report that, let me go back home and ask my husband whether she will allow the child to get this vaccine. So we used to give the health talk in the facility. We organized for several outreaches to the community. We did around 40 outreaches to the community because sometimes it's not easy to get parents to the hospital. Also a male client in MCH, it is not easy.
Just the same way we can equate it to COVID. It doesn't mean when you are vaccinated against COVID like twice and you get a certificate, you will not get the COVID. But again, it reduces the burden of the disease, prevents complications. Yeah, we always tell them, and with the time, it was not a one-day thing. With the time, slowly by slowly, they started understanding this thing. Yeah, so that's what encouraged them to start bringing their children to this place.
Every child taking part in this vaccine trial has to get 4 injections, offered at 6 months, 7 months, 9 months, and finally at 24 months. For parents like Tola Amalemba, who know too well the pain of having a child admitted with malaria, she gladly took up the offer when approached to take part in this pilot vaccine.
Mtoto wangu mwenye huyo anafuata ni mkubwa sana, karibu 13 years. Hiyo wakati haikukua. Mtoto alikuwa anasumbua. By the time anafika 6 months, anapata ni mgonjwa. Kidogo huko hospitali, kidogo huko na unalazwa kila mara. Lakini huyu sijawahi lazwa. Ile kidogo homa tu hiyo ni kawaida. Lakini malaria hajawahi kuwa nayo tangu mpaka sasa hivi. Nimekuja na ndio imenitia moyo kila mara ninasema ikifika nikuje.
Vena Akinyi's older child has sickle cell anemia, an immunity-compromising condition. Vena says it was normal for her children to suffer from malaria every time they visited her rural home, until she heard about the vaccine when she brought her youngest child, Oliver, for his routine clinic.
Tukitravel kutoka Nairobi, tukitravel lazima wagonjeke malaria, na tukirudi lazima wagonjeke malaria. Malaria ni mbaya, malaria inaweza kuua mtoto. So hata ukigonjeka malaria, unajua sasa hapo lazima kuwe na wasiwasi. Juu mtoto mwingine ni sikla. Sasa akikuwa na hiyo malaria ni stress juu anagonjeka sana mpaka sasa unajua mtu wa sikla na malaria anaweza kufa.
Oliver was receiving the second dose, and Vena says she hasn't made a malaria hospital visit so far.
Unajua kichanjwa itanini hata kuwa na hiyo nini hata kigrow bado atakuwa tu sawa juu already amechanjwa.
What is your message for parents when they maybe wataanza kufanya hiyo for the first time?
Naweza kuambia wafanye waende hiyo vaccine. Hiyo vaccine ni poa. Juu itazuia malaria. Unajua tunazuia hiyo ugonjwa. Hii malaria inaua. So tukienda hiyo vaccine hatutakuwa na vifo ya malaria kwa watoto.
Na ni muhimu kwa mtoto. Mtoto ata grow akiwa na afya kwa sababu hagonjeki. Unajua akipata magonjwa kila saa mwili inakuwa dhaifu. Juu kila mahara ako hospitalini, lakini akigrow tu bila kugonjeka anakuwa healthy.
For Jessica Omutiti, her preterm baby's survival is due to the vaccine, she says. Gift is her youngest of 3 children and has received his 3rd dose.
Nilifungwa na 30 weeks. Karudi nikakaa nikawaza, haka katoto nakabembeleza tu. Sasa ikifika mahali kapigwe na malaria, itakuwaje? Sitanisumbua kama mzazi. Ndio nikaamua, liwe liwalo, hii vaccine yenye nasikia nitafanya nini? Nitaenda. Kaenda nikapatiwa ya kwanza. Kitu yenye niliona ilikuwa tu body temperature ndio ilipanda kwa hiyo siku. Haya na tulikuwa tumeambiwa ukiona body temperature inapanda, hiyo ni kawaida, unampatia paracetamol after 24 hours. After hiyo 24 hours nikampea paracetamol, mtoto akawa mzima.
The first 1,000 days of life for a child are the most critical, and this is when they're expected to adhere to their vaccine schedule. Now here at the Yala Sub-County Hospital, especially at the Mother and Child Clinic, is where researchers who have been conducting the malaria vaccine pilot project have been scouting for mothers, who most of them are coming in with their children for their final doses. According to health officials here, they say the malaria vaccine has seen a decline in the number of admissions at the wards.
The beginning of the last financial year to the end, we had around 1239 admitted, tested and positive, but then the admissions were quite few. Then again this year, we had around 101 admitted with severe malaria only compared to the previous years before this exercise began.
The Yala Sub-County Hospital represents the primary health facilities in rural Kenya that to date cannot cope with complicated medical procedures. And here, where malaria is the leading cause of death in children, health workers are overwhelmed by the number of admissions and underage deaths due to severe malaria. The region's checkered past with HIV also makes it difficult to get clean blood for transfusion when a patient is admitted with severe malaria.
We used to transfuse a lot before this exercise began of vaccinating with malaria. Like in a day, we will transfuse at least 4 pediatrics, and to be specific, under 5s, or 5. In Nyanza region, the burden of HIV is quite high. So however much people will donate, will not get safe blood. So at some point, we'll go as far as Eldoret or even borrow from Kakamega. Between 2019 and 2020, we borrowed blood all the way from Webuye. And you know, fueling an ambulance, okay, as our transport to get blood was quite expensive for us. Right now, because of the vaccination, and then again, the cases going down and the complications going down, to be specific now, narrowing down to anemia, severe anemia, we are transfusing less compared to what we used to do before. We can do 2 weeks transfusing, specifically a child with severe malaria because of, severe anemia because of malaria.
This facility is supported by 17 community health volunteers who continue with informing community members on the benefits of the vaccine, and the results have been promising. Once a child has been vaccinated, it is Jane Masinde's responsibility to follow up with the parent on the progress of the child. Jane is the community interviewer working with researchers in this program. She is part of a team of community interviewers spread across the 25 sub-counties where the vaccine is being administered. We tagged along as she visited a client.
But malaria to sebetu.
This child contracted malaria after his last dose of the vaccine, but has since been treated and discharged, and is now recuperating at home. It is follow-up visits like this one that provide necessary data on the efficacy of the vaccine during the trials.
In game as a whole, we have around 3,000 participants that we follow up. So personally, I have 231 participants. So immediately these children get the vaccine, the malaria vaccine. It's either they give us a call or we call them immediately they turn 6 months. We give the mothers a call to confirm if the child has been vaccinated. We also visit the health facilities to confirm if these specific children have been vaccinated so that we can start following them up. So we do the first follow-up or the first home visit at 6 months, 5 to 10 days. The second vaccine is being given at 7 months. We want to know all the vaccines that this child had received, plus the pentas, plus the polio, every vaccine that this child received before. We collect any medication on malaria within 14 days or any other medication on malaria that had been given since the last visit. We visit these children up to the age of 5 years. So it's from 6 months up to the age of 5 years. So we are so specific on malaria because we want to know if this vaccine, is it really working?
Jane also uses the home visits to clear myths surrounding the vaccine.
Before, these mothers used to fear. You find that you are in the facility, the child is 6 months, you tell the mother that, you know, today your child should be receiving the first dose of malaria vaccine. And it's like, you know, just some rumors that these children, the children that who receive malaria vaccine, they have fever, they have, I don't know, convulsions, but it's not true. Just like any other vaccine, when the vaccine is new in the market, it has a lot of rumors. Malaria vaccine, I can say from my own perspective that is safe. It's very safe according to the follow-ups that I've done. So I would like to encourage the mothers who still fear just to take their children for the vaccination.
How much can one of these compartments maybe contain? How many slides are those?
So for all the studies that we do,
back at the lab at the Kemri campus, Dr. Kariuki and his team continue analyzing data from the different malaria studies they have been carrying out. To him, the approval of the vaccine for large-scale use is an affirmation of his 30-year journey to help ease the burden of malaria in the country.
The malaria vaccine is the first vaccine that has been approved against a parasitic disease in humans, which is a huge, huge milestone. The malaria vaccine, which has recently recommended by the World Health Organization, has been in development for the last 30 years. So it was around that time that we were trying to understand everything from people who were suffering from malaria to the what makes some other people not get malaria. So that circumposite protein is what has been the focus of the current RTSS malaria vaccine development for the last 30 years. They are able to isolate it, study it, find out what makes it cause immune responses in human beings, and then develop recombinant protein to produce it in the lab, now that it's not in the mosquito, and then combine it with hepatitis B to come up with RTS. Like any vaccine or drug, it has to go through phases of trial. The phase 1 is where you try it in humans, a very small population of humans in the country where it was developed. And then you move on to phase 2, where you test it in a country where malaria is a big burden, but not in the target population, who are children who suffer the most severe consequences of malaria, but in adults, to make sure it's safe and it induces immunity. We came in at the phase 3, where now it has to be tried in the target population, children under 5, in a large area, in order to show that it's safe, it can protect children against malaria, and it's cost effective. We have been evaluating the pilot program for 2 years now, and the 2 years results is what has informed WHO to recommend it for wide-scale use.
The vaccine is what we call the first-generation malaria vaccine, and there are efforts to improve its efficacy, and other vaccines are also being developed concurrently. According to Dr. Kariuki, the malaria parasite has developed resistance to current treatment regimes, and the COVID-19 pandemic saw funding towards malaria prevention dip globally as governments diverted all resources to deal with the pandemic.
When COVID came, there was disruptions, some modest disruptions of those commodities that prevent and treat malaria. And there were an additional 14 million cases in the world, when we were expecting that they will go down, and the trend has been going down, and an additional 69,000 deaths, most of them occurring, 95% of them occurring in Africa.
Climate change has also seen malaria becoming problematic in regions where the disease was hardly reported. In January this year, Kericho, a highland area, was hit by a malaria outbreak, an indicator that rising temperatures in the highlands are changing malaria patterns. Traditionally, malaria has been endemic around the coast and lake region.
The mosquitoes are becoming resistant to insecticides, and parasites are becoming resistant to anti-malarial drugs. Increased financing, we come up with new insecticides, we come up with new effective drugs, and we have political goodwill from our government with pushing for universal health care. If the vaccine can reduce even a half of those malaria episodes, I think it will be a big relief to many families that suffer from this ancient disease.
The vaccine is just one aspect of the ongoing malaria research in the country, and it is in labs such as this one at the KEMRI facility in Kisumu that continue to inform government policy in its efforts to rid this country of malaria.
Kenya has since rolled out the distribution of the malaria vaccine across the country, and scientists are hopeful that the vaccine, though not a silver bullet, will push forward the ongoing efforts to develop other vaccines that can be administered in adults too. In the meantime, health workers are hopeful that the number of children dying due to complications from severe malaria will significantly reduce. Bridget Ngona, NTV.